The first thing I remember from the time when I started struggling with mental health was probably turning up at the doctor's to make an appointment when I was about 15, 16. But I didn't really know what I was making an appointment for, and I didn't know what I was supposed to say. I just knew that I was really struggling, but I couldn't really articulate it. So I ended up cancelling quite a few appointments during that time. My teenage years, from being sort of 15 to 18, 19, there was quite a lot of traumatic experiences, really. My mum was diagnosed with breast cancer, and she went through quite a lot of chemotherapy. We were told to expect the worst. There was divorce from my parents, and at 17, I left home and I had to live in a hostel for a little bit. And I think during that time, especially in my generation, mental health and emotional well-being really wasn't spoken about. And I didn't have the words to ask for help. So I couldn't really get what I needed. But I think the turning point for me was going through that experience, especially the homelessness, and being in that place where you're asking for support from different agencies, and a lot of what I was met with was quite patronising sometimes, and I felt spoken down to and just not listened to, and I really felt passionate about that line of work. And so when I was 20, I started working in a young person's hostel, and that was my first job, and I found a lot of healing from the support there, and being able to use my negative experience that I'd had as a teenager and turn it into something really positive. And I think I used that to help me with my well-being for most of my 20s until I had children, and it sort of triggered off anxiety and stress and overwhelm all over again, and I was right back at the beginning with no tools. So for me now, I think my biggest learning curve is realizing that I have to take responsibility for myself, and it's all right having lots of ideas around, exercise and eating healthily and meditation, but we've got to show up to these with consistency, and we've got to take responsibility and make it so that these things are things that we enjoy and things that fit into our lives, and that fit around our responsibilities, and that we show up to them every day, as a prevention, because none of us are immune from anxiety, stress, overwhelm, low mood, and it has to be a priority. We've got to put ourselves first so we can give what we, give the best of us to everyone else.
My story is that I was starting to experience negative aspects of mental health before I understood what they were. I remember always when I was young, I would be doing creative things and little things. I'd make sculptures out of blue tack and things like that. But I remember also there was kind of emotions that I didn't understand. And as I got into my early teens, I started to really, really struggle. And I met people who were going through similar things at school, and then I had words to explain what it was. I could say that I felt anxious or that I felt depressed, but I still didn't ask for help for a while because I just relied on the support system I had in my small group of friends. And then it got to a point in my later teens when I really wasn't coping and things were kind of very overwhelming, and I didn't feel like I could turn to anyone. And I made myself an appointment at my GP, and I told them that I didn't know what to do and that I wanted some help. And they did a referral to CAMHS for me, and at my request didn't tell anyone, didn't tell my parents, even though I was still a teenager, because I felt like it was something I had to figure out on my own. I felt like my mental health was my own responsibility and that I had to sort it out myself. And they put me in contact with a lady who came to see me once a week at school, kind of in secret, and she figured out that I was quite creative, and she introduced me to Alma. And I remember the day that Alma turned up at my school from City Arts, and she had a bad back from lifting something off the back of a truck in a carnival. I remember it really clearly. And that was a really kind of life-changing day, because I, for the first time, met someone who had a career in a creative industry. And she told me about this project called Express Yourself that I could go to. And it seemed like this just little safe space where I could meet other people like me and do something fun. And I knew it was something my parents would approve of, and I just felt like this might be a really, really good option for me moving forward. It was an amazing experience, and I remember it really well. The first one, we did some photography, and I remember being invited back for the next project, and I started volunteering because at that point I'd kind of turned 18. So Alma said I could volunteer, and I was assisting the artists with things and starting to sort of try and lead on sessions. And that's when my journey of being a facilitator began, because I learned how to start teaching people things, and that I really, really enjoyed it, and that I was good at it. And I get a lot of joy from showing other people how to reach their own potential, especially creatively. And from there, I met someone who worked for Arts Award, and I became part of the Arts Awards youth network as the East Midlands representative. And I ended up doing things I thought I'd never do, like speaking at regional conferences, and going to kind of residentials with strangers that I didn't know, and kind of being an activist. And I went to university and college and studied fine art, and figured out that this is what I wanted to do. When before Express Yourself, I was pretty certain what I was going to do was find the first job that I could that paid enough for me to move out, and just survive that way. But going through the process of Express Yourself kind of showed me that I could do what I wanted to do, something that was going to be good for my mental health, and kind of something I could do to help other people's mental health. I actually had my own business for a little while, and I did things with schools, with children in schools. I had sessions that I ran, kind of therapeutic art sessions with a group of refugees, and I actually spent some time at the QMC on the wards doing therapeutic arts with the older people, and unfortunately that had to come to a close when the pandemic started, and so I started working in a care home instead, doing the activities for them. So it's helped me figure out ways that I can use my creativity to help other people, and I figured out that that's really what my passion is, and it makes me feel good about myself. It makes me feel like I'm making a difference. I still struggle with self-care though, because I have that idea that I always need to be doing something, and there's that pressure that you need to be productive. So if I take a self-care day and don't really do much, I feel like I've not achieved anything. But I know that that's wrong, because even if all you do is survive a day, you've survived that day. Even if all you do is process your emotions, that's really valuable time well spent. So if I could give anybody advice about how to do self-care, it's to not to put any pressure on yourself, and just accept your small victories and be proud of yourself for being able to survive the tough days, because they are tough.
Well, I've always struggled with anxiety from an early age, because my brother is diagnosed with autism. So throughout primary school, I was always recommended by the teachers and stuff to sort of have these counselling sessions, especially from like my brother's psychologist at the time. And I was just having little sessions. In primary school, I had to come out, and like I didn't understand the effect that having an autistic brother has on someone's mental well-being. And even then it sort of developed into something later life. So even in secondary school as well, I struggled a lot with anxiety, and my brother has sort of contributed to some of those things that I struggle with. But it's putting something for your anxiety, it's doing something to try and help it. So for me, I've always had a passion with photography and textiles. So I always used to, if I was anxious or for any reason, I always used to go and take some pictures, or just go for a walk, just something to help myself, and just make some sort of little project book or something like that. And that's why I chose to do photography as an A level, because I enjoyed it, and it's what helped me get through the stressful times when I was going through with my brother. And even now, I'm volunteering, hopefully soon to be volunteering for CAMHS. And it's made me realise that I want to work in a mental health facility. I want to do something along those lines, helping young people with their mental health struggles. So in a way, it's sort of made me realise how important sort of getting help is and helping yourself.